Yeah, in fact, it's true that now computers may aid dermatologists, and new algorithms are able to diagnose skin cancer even better than experts in some studies using images, never in real visits in front of a patient. It's true that these algorithms will help the performance of dermatologists and probably also for other physicians, general practitioners, or maybe in the future also for the selection of patients to go to the dermatologist. But I think that it will be very difficult to completely replace dermatologists because somebody needs to take decisions, and because there are many limitations at this moment with computers. Computers are trained with frequent diseases, and rare diseases are difficult to be trained for computers because we have very few data, while doctors can have this knowledge. It's also true that algorithms can do a very good performance for one problem, but at these moments they are not trained to solve many different problems at the same time. And dermatologists can visit and diagnose skin cancer and treat psoriasis at the same time. For this reason, I think that dermatologists will have job for a while, but it's true that also dermatologists and patients will benefit from the help of the computers. Of course, there are many human behaviors that at this moment computers cannot do. Empathy with the patient, to choose a better explanation for the patient to understand what is the situation, even application of treatments. Even it's true that we have some robots to help surgeons. Usually it's a surgeon behind them doing the job. It's true that there are many human components that are still not possible to be substituted by a computer. We're talking about diagnosis and moving to therapy. It will be extremely complicated to substitute a doctor, but for sure doctor will need also computers to calculate the best chance for response to therapies when we will have complex biomarkers. And for sure, again, it could be an aid from computers for the best decision taken together, the patient and the doctor, with the best information. No, in fact, there are some of them that can be available for some studies, and even some apps can be downloaded, but without a clinical validation. It means that even we are close, I cannot say that it's something that we can use now. Yeah, but in that point, I think that computers will help, because many competitions in artificial intelligence, then all the code or codification is open, and then can allow for the majority of population to reach these algorithms. I think that could be the contrary effect, that more people will be able to reach a good care. It started many years ago, but now the improvement is exponential. And this exponential improvement is not because algorithms are much better now. It's because we are able to have big amounts of data, also images that can be analyzed automatically by the systems, and because the capacity or computational capacity is much bigger now. It means that with this exponential growth of the computer abilities, probably the implementation will be also faster than we thought. Yeah, computers are with dermatologists to stay, and I'm pretty sure they will be necessary, and in the future, even we cannot avoid to work with them. Some of our functions will be replaced by computers, and others will be kept in the hands of dermatologists for sure.